Good afternoon, everybody, and welcome to this Council of Deans of Health webinar as part of Research Month on the Research Excellence Framework 2029. I'm Ed Hughes, I'm the Chief Executive at the Council of Deans of Health. I'm facilitating today's session, and it's a great pleasure to introduce our two speakers who are going to take us through this. First of all, Kim Hackett, who is the Director of Insight and Engagement at Research England and part of the senior team providing oversight to the REF exercise at the moment, and Professor Jo Rycroft-Malone, who's the Pro Vice Chancellor of Research and Enterprise at Lancaster University, and today is here as the Chair of Subpanel 3, which covers dentistry, pharmacy, nursing and allied health professions, and as the Deputy Chair of Main Panel A, which covers the health-related disciplines in the REF 2029. So we've got a distinguished cast to take us through the latest on what's going on with the REF as we go into this criteria setting phase. And what we're going to do this morning is, it's this afternoon now. What we're going to do this afternoon is to start with an overview of the exercise from Kim and some of the latest developments, and then move into some of the more subject-specific issues which Jo will take us through. And we'll have some opportunity for discussion on any questions, comments at the end of that session. So if you do want to put in comments or ask questions, please do use the functionality at the bottom of your screen, on the toolbar at the bottom of your Zoom screen, in the chat or the Q&A, and we'll keep an eye on that. And when we get to the Q&A, we'll feed that back in and try and answer as many of your questions as we possibly can in the time that's available. So without further ado, if I could hand over to Kim, who's going to start us off with an overview of where we are with the REF exercise.
Yeah, I'm going to start by sharing the slides, which I hope you can see there on the screen now. Thank you very much. I'm delighted to be here. I did speak to the Council of Deans a couple of times in my previous role as Director of REF 2021, so delighted to be here talking to you about the current exercise. As Ed indicated, I'm just going to provide a bit of a sort of overview on where we are currently and give a bit of a focus in on one of the newer aspects in the institutional level SPRE side of things. What I wanted to start by saying is that I know that some of you will be perhaps following the information more closely, may have heard the previous webinar that Jo came and spoke to you about the progress on REF, and so I have assumed some level of knowledge. I'm not going into the fuller details, but if that's not you and you do have questions about the background or some would like to go into the depths of some of the structures and framework more so than I'm going to do today, don't hesitate to get in touch with the REF team at Research England, myself, or even through Ed at the Council of Deans, and we can certainly furnish you with the information that you'll need. Just to start by summarising that in December, we published quite a raft of information that followed a period of pause where we were taking stock and seeking to ensure alignment and with government priorities and reflect on some of the sector feedback we'd had. So when we got to December, we were at that stage ready to publish the sort of conclusions of that period of time, and published a suite of information that introduced the strategy, people and research environment element of the exercise, and some other key aspect of the guidance that were being announced at that stage, including the overall weightings for the different elements of the assessment. some of the key changes that we'd made to the existing guidance that was a consequence of that reflection that we'd been making in relation to the sector feedback. And all seeking really to continue to incentivise excellence, align with government ambitions, and crucially as well, seek to reduce burden where possible. So detailed on this slide are a range of those things that did come out at that stage, including major aspects of the guidance with indications throughout that information where there would be final details and further information provided through the development of the panel criteria that was signalled later in 2026. So that brings us on to a look at the timetable overall, and that gives you a sense of where we are in the process currently. So we're where the star is. And that is deeply in the criteria setting phase, really. So what we're doing at the moment is working closely with our expert panels to finalise those aspects of the guidance that are outstanding, to ensure that the panel criteria are fully developed and drafted, and the working methods as well, and working through that process with the panels. And I know Jo's going to say a bit more in terms of a live update from that process in a bit, in order for us to meet that overarching deadline to get the guidance and criteria out to you later this year. Now, do you just want to spend a minute talking about the timetable in this sense, because of the pause period that did have an impact on the overarching time frame for the exercise, but we were really keen that we didn't want to delay the sort of scheduled point of providing the guidance and criteria to institutions. So we sought really to condense this period of time where we're working with the panels on that criteria development, and that had the consequence of meaning we could no longer schedule in that consultation period that we'd originally envisaged into this period of time. So what's happening instead is that both the panels and the ref team directly have been undertaking engagement with the sector in various ways to ensure that we can both give you a sense of where we are in the development process, but also to sort of gather input as we go along with some of the points of detail on the final bits as we seek to refine those. And we're just continuing to assess as we go through this process where we might need to just undertake those further targeted sort of pieces of engagement, really to ensure that we come out with that fully robust set of guidance and criteria. So that's broadly where we are. Later this year, we'll see the publication of that material, and then we'll be going into what we describe as a submissions phase, where institutions will, of course, be going into having that certainty of the final guidance and criteria, going into that full submission preparation mode ahead of submissions, which will be late in 2028, for the panels then to undertake the assessment in 2029. So that sort of gives a background as to where we are in the process currently. And what I want to now go on to focus on is one of those key areas where that's newer for 2029, and where we're focusing in on developing further guidance and criteria with the panels at the moment. And that's in the strategy, people and research environment section of the element of the exercise. So I'll start with what we've already said in the information that was published in December. So this element focuses on the conditions that are an essential feature of research excellence within institutions. Overall, it's an approach that's evolved from the environment template that we had in Ref 2021, building in and being shaped by the feedback from the PCE pilot that was conducted during the course of last year. The SPRE will be assessed at both institutional and unit level, and overall will account for 20% of the overall weighting in the exercise. And to make up that 20%, the institutional level statement accounts for 60% and the unit level statement accounts for 40%. We've got a continuation of the criteria for Ref 2029 that we've had previously for the research environment. So that's vitality and sustainability. And we're working at the moment on those detailed definitions for those criteria with the panels. The institutional level statement is going to be assessed by an institutional level panel and the unit level by the relevant subpanel, who will, of course, have sight of the institutional level statement. And I think what's key, and particularly drawing on the insights from the pilot here, will be the use of indicators and evidence, recognising both qualitative and quantitative data to strengthen the narrative throughout the template that's returned. And also an emphasis on the distance travelled, which really, again, drawing on the insights that we got through the PC pilot, is seeking to build in really that recognition of the time that's needed to build excellence, and to see that described through the statements that come in, so that the panels can understand that in the context of the individual submissions. As with the previous exercise, we will have input from the advisory panels on the assessment of the SPRE statements. So that will be PDAP and RDAP providing advice on the relevant, the aspects of the statements that are relevant to them. So overall, what we're aiming for is to provide a set of guidance and criteria that will enable institutions to submit statements that work together across the piece. So we're working now with the panels on guidance and criteria that can best enable this, building on the guidance from 2021. It's clear that strong statements are going to demonstrate integration. Within the broad focus at the institutional level is focused on the strategic elements, and the unit level on implementation. There will be guidance provided for each section of the templates, but it's also clear that the panels are going to assess these holistically, so that that they will be reaching their their assessments for each section based on the holistic information in the template overall. So on to the last area that I wanted to share with you today before I hand over to Jo. I just wanted to dwell for a minute on some of the points that are emerging from our institutional level cross-panel working group that's been established to help develop the guidance and criteria for the institutional level SPRE statement. Just to give you a sense of the emerging findings and the considerations that the panels are making in relation to this aspect of their discussions at the moment. So the first of those is around coordination between the institutional and unit level activity, which is the sort of building on that point I was just describing there, really focusing around having clear evidence of integration across the two templates, a clear demonstration of the two-way relationship, so how both the strategic direction but also the implementation sort of reciprocally feed into each other across institutions, really with an ambition to avoid duplication across the two statements. The second area is around their holistic coverage of institutional priorities. And this is about how the institutional level statement can best address the range of units that might be relevant to that given institution. So really wanting to derive a whole picture through the institutional level statement, not having a sort of range of isolated examples taken from individual units. That doesn't mean every unit being named in the statement, of course, but a demonstration of the translation into improved researcher experience, for example, across units. So just to remind again, these are the current points that the institutional level working group is putting forward to the panels for their consideration at the moment. So these are the points feeding into the panel's discussion on which the final guidance and criteria are going to be built. So the third area is around that critical reflection. So coming back to thinking about that distance travelled point that I was discussing a little bit earlier. Balanced in the context of both internal and external changes and challenges at the moment, and the way that institutions are learning from that. Understanding a bit about how resource allocation, strategic focus, and maturity of research culture strategy is supporting excellence, and recognizing the gap that there exists oftentimes between ambition and reality, so that we're not there's a sort of position of not expecting to see uniform improvement, but wanting to understand about the measures that are in place or have been put in place to identify and address gaps, and that those processes are characteristic of effective environments. And finally, on the effectiveness of policy. So this is about thinking again about the evidence-based nature of the narrative that's provided in the statements, a tightly coupled narrative with evidence around improvements and progress, and where that progress is limited, around providing an understanding of why that is, and how that's informed action and decisions within the institution. And again, underlining an importance of there needing to be evidence across the life cycle of activity, for example, enabling sustaining excellence across the breadth of disciplinary areas or interdisciplinary research, or around co-developed and delivered improved environments across the units, and how policies and are being evaluated and addressed through the insights that are being sought. So that gives you a sense, I think, of some of the key areas that the panels are considering in relation to developing their guidance and criteria in relation to this aspect of the overall framework. So I'm going to stop there. Happy to come back to any questions on any of this material at the end, and I'll hand over to Jo, who's going to focus in on the work of the panels.
Great, thank you, Kim. So I'm going to say a little bit about our current work and activity, the sorts of things that we have been discussing, and Kim's done a great summary on the sorts of things we have been discussing, in particular around SPRE. Then I'm going to talk a little bit about the discussions to incorporate clinical academics into our thinking with this exercise, in particular in relation to SPRE. And then I'm going to give you an update on the descriptor and taxonomy that I talked about when I came, I think, in around March time, and where we've got to with that, which is still draft, but it's moved on since when I came to talk to you then. So as Kim has indicated, we're very much in the thick of developing our working methods and criteria, and I wanted to just restate some of the principles that I talked about last time in terms of the way that we are trying to go about this, and this is very much trying to ensure that we minimize burden on institutions, so trying to focus on what we did do in REF 2021 and build on that, but not dramatically change that, so that there's some level of understanding between exercise 21 and 29. I also need to stress that we are keen on ensuring a level of consistency. So that, and by consistency, I'm just meaning between 21 and 29, given that there have been some policy changes in the exercise, but thinking about our criteria and our working methods within panel A, within the sub-panels that sit within panel A, but also across main panels. So we're working hard when we have our main panel meetings to try and calibrate across the main panels. Again, thinking about, I think really the burden, minimising the burden on the community. That said, of course, we do need to take into account disciplinary nuances and where those need to be taken into account for sure. We are having those discussions. So we're very much in the thick of considering CKUs, a contribution to knowledge. Sorts of issues we've been discussing are around the types of outputs, interdisciplinary nature of outputs, and how we would recognise those and expect those to be recognised from submissions. Issues around substantive links, given the change to the exercise this time with respect to decoupling. Issues for us around double weighting, around long form outputs. So those are the sorts of conversations we've been having in our working methods criteria setting around that area. With respect to engagement and impact, so engagement obviously is that new element to this part of the exercise this time. Thinking particularly informed by a working group around engagement and impact, how we can incorporate within the narrative of an impact case study the type of engagement that might have taken place to reach the impact that is stated within those impact case studies. Now, we all know, of course, that sometimes impact happens serendipitously. It doesn't always have those sort of roots through engagement pathways, but where they do, what that might look like within an impact impact case study. And then, as Kim has articulated really nicely, the sorts of issues we've been talking about in relation to SPRI, and just to I think amplify really a couple of points that she made, that point around complementarity and integration of the unit level with the institutional level, where the institutional level statement is very much about institutional strategy, the unit level around how is that being operationalized within units of assessment. And I think also, as Kim said, we're interested in what's been described as distance travelled. So that includes a sort of, I think we want to try and encourage and include, and I know I recognise this is challenging with a research excellence framework process, but an honest reflection of distance travelled and how the community feel they have managed to develop their context in the context of everything else that is happening within the higher education sector just now, which we're all very, very well aware of. So those are the sorts of issues we've been discussing in our working methods criteria setting meetings. We are about to go into a second round of sub-panel meetings, which are going to be in July. And so out of those meetings, there'll be further calibration across the main panels. And then as the timeline that Kim showed in her slides earlier shows, that the guidance will be with us, will be landing with us in the autumn period. We've also in main panel A been talking about how we can get a sense of our clinical academic population, if you like, and that's very much driven by policy from a medical perspective, as well as the policy from a Council of Deans for Health perspective, and very much aligns with the working group that Jane Code's leading for the Council of Deans for Health with respect to nursing midwives and allied health professions. So the definition that we're working to is a definition that is I guess what could be perceived as the true definition of clinical academics, where colleagues would have a substantive contract with the university and an honorary contract with a clinical area, clinical usually trust. We recognise, however, that only makes up a certain proportion of the clinical academic workforce within our disciplines. So we're working on thinking through how we can accommodate within more of a supplementary narrative type way the other types of clinical workforce that we within our disciplines work with. This is very much a live conversation and will be threaded through the meetings that we have in July and beyond, because it also relates to how the data are collected at the moment through HESA, and then how we manage that through the REF process. But I wanted to reassure you, given it was one of the things that we talked about last time, that it is something that we are taking seriously in terms of our consideration for our expectations for this time round for REF 29. So just to finish on a few slides then, which I'm hoping, Kim, if you wouldn't mind putting up, revisiting the descriptor that we looked at in the meeting in March. Just a caveat, it is draft, so this is still to be locked down, as it were, but it has moved on a little bit, expanded a little bit since you saw it in March. And it's expanded with the input of the conversation I had with you in March, conversations we've had with criteria setting members, but I sought the views of our assessment, those that we've recruited to our assessment phase. I also sought their views on our direction of travel with this as well. So it's had a good set of eyes on it thus far. So we have, for example, with what you're seeing now in terms of the descriptor, included a specific reference to clinical education, to theory, and to healthcare technologies, which I don't think were there when I spoke to you in March. Then the next slide goes into more detail in terms of the different areas of our professions, so the sort of areas that we would expect under allied health professions. This is a bit of an expanded definition on what you saw in March, a bit of a tweak of a definition with dentistry, the midwifery definition. Helpfully, Venora Hundley, who I think may even be on the webinar, has supported the definition here, which I understand is a Lancet agreed definition for midwifery. And then nursing, hopefully you would recognise the sort of components within that nursing definition, and our pharmacy colleagues have supported us with developing that pharmacy definition. Now these descriptors will be used to help the community understand which unit of assessment they're likely to be submitting to. So that's why we need to get them as appropriately right as we can, and with as enough eyes on them as we can, so that they resonate with the community and it's clear. There's a clear understanding about where best to submit work to. We've also been working on a taxonomy, and there's a lot of words on this next slide. This taxonomy is also going to be helping us to understand the outputs that come into the submissions, from your submission into the process, and help us work out whether we've got gaps in our panel membership where we might need to seek additional input into the panel to make sure that we've got the right expertise to look at submissions. They're also going to help us from a mechanical point of view in terms of when we get to dividing up our outputs and other parts of the submissions to the relevant people that we have on our panel. So again, we've done a lot of work on this to try and make sure it's clear, it's detailed enough, because as you know, this unit of assessment is extremely multidisciplinary, that we've captured the relevant areas that will help us with the process and help you understand what your submissions may be looking like when you put them forward into the REF process. And then finally, we've been very attentive within our discussions within main panel A, but I think the same could be said across the other main panels, around issues around interdisciplinarity and issues around boundaries. So we want to make sure that people can find a home for submissions. And so we've been very clear that the boundaries in particular are porous across the units of assessment, and we're trying to marry the descriptor and the taxonomy with that porosity, with understanding, or trying to convey an understanding of the sort of research that we're likely to see in Unit of Assessment 3, and that's detailed in that boundaries section in this slide. And you'll be aware, for those of you who are familiar with Unit of Assessment 3, that it very much, the submissions will range from laboratory-based work right through to the sort of research that we do in practice, in both health and care practice. So it covers a wide range of areas. So we're hoping that these statements capture that that breadth and that and they're comprehensive, essentially. So that's where I was going to finish my contribution to this presentation bit of the webinar. But I think Kim and I, Ed, are happy to take questions from those on the webinar now.
Great. Well, thank you very much, Kim and Jo, for that really helpful update on where we are at the moment, and really good to see the progress that's being made. I know our members will be particularly interested in how things play out in terms of the consideration of the wider clinical academic community in nursing, midwifery and allied health, amongst other things. We have plenty of time for questions, and we have a very distinguished panel here to answer those questions. So if you have questions about the ref, now is your time to speak directly to those who are shaping the exercise for our community. Do pop things into the question and answer section on the toolbar. I think there might have been some problems with using the chat function. So if you've been trying to use that and haven't been getting through, pop it across into the Q&A section, and we'll endeavour to pick those up. During the presentations, there were a couple of questions about some acronyms that were used. So something about the People and Diversity Advisory Panel, PDAP, and the Research Diversity Advisory Panel, RDAP. And I wondered, Kim, do you want to just say briefly a little bit about the role of those panels whilst others are thinking of questions?
Yeah, sure. So we've got, as you have elaborated there, two advisory panels in place who are providing advice, with PDAP providing advice in relation to the diversity of roles and careers in relation to research, as well as considerations around equality, diversity and inclusion. So that role relates to general advice to the funding bodies on the development of the guidance and criteria, advice on the assessment of codes of practice. That, I should flag, is something that's underway at the moment. It was highlighted on the timeline, but that is process the funding bodies are undertaking currently to ensure that institutions have in place those approved codes in advance of to govern their approaches to submission. And then moving forward, that they'll continue to provide advice on the range of areas that interface with people across the exercise. So including in giving advice to the subpanels on the assessment of the people section of the SPRE templates as well. So the Research Diversity Advisory Panel have a similar remit, so they are set up to provide advice along those same lines, but focused on research diversity. So that's the various ways, methodologies, approaches to the undertaking of research, including interdisciplinary research. So they are working across in the same way, providing advice to funding bodies, the panels, and so on. Jo, were you going to come in on any of these?
Yeah, I was just going to say a bit about how then is playing out in the discussions we're having. So we always, so colleagues understand, I guess, a bit more about the process, that we always have representatives from those groups in our discussions, so that they are very much in that advisory capacity. And when we are, as Kim said, when we are developing our working methods and our criteria, so that we're very much incorporating their expertise, because that's what they come with. They come with particular expertise. So it's been extremely helpful to have those colleagues within our meetings. So they will be in main panel A meetings and other main panel meetings, and they will be present in sub-panel meetings as well.
Great, thank you, Kim and Jo, for that. It's really helpful. I think there was a question from Fiona Cramp, and I don't know whether, Josie, are we able to unmute Fiona to
do my best?
All right.
Hope that works for you, Fiona.
I don't think I had a question. Sorry, I'm not sure where that is appearing.
Oh,
okay, you've got
to
a
worry.
hand up, so that's all right, not to worry. So a question on the URA descriptors, and then one on clinical academic careers, which I think gets to the nub of the issue on that. But on the URA descriptors, is Unit 3 the home for counselling and psychotherapy? You're muted, Jo.
Sorry, apologies. It could be with Unit 3. This is the porosity of boundaries. It could also potentially sit with the unit of assessment 4. Yeah.
Great. Thanks, Jo.
Either would accommodate. Either descriptor, I think, from what I've seen of unit of assessment 4, descriptor would accommodate. But I would encourage everybody to look at those descriptors when they are published.
Great, thank you, Jo. That's helpful. And just on the descriptors, I noticed with the descriptor for nursing, it talks about advanced practice, but advanced practice might be found in other allied health professions, for example, and midwifery as well. And I wondered whether there was a particular reason why it had been identified as an area of research in nursing, but not highlighted elsewhere. And also I wondered within the public health area, public health nursing, whether school nursing might be a separate area, or is considered to be encompassed within the public health space.
So thank you, Ed. And from an advanced practice point of view, that's a good pickup and something for us to reflect on. Whether we would want it more in a STEM rather than in each of the level of the descriptor. I think we got to a point with nursing in particular where it's sort of how far do we go down the detail of the, so we would, and of course nursing, we would want to be inclusive, so we can think in particular around school nursing, but for sure we would it would be accommodated within community and public health nursing.
Yeah, great. Thanks, Jo. So then there's a question on clinical academic careers. So basing the definition of clinical academic careers on staff with substantive HEI contracts and an honorary health provider contract would exclude most nursing, midwifery and allied health professional clinical academics. Can you say any more about how different types of contracts might be included?
Yes and no, because at this point what we're trying to understand is how HESA codes reflect the different types of clinical academics that there are in nursing, midwifery and allied health professions. And I know, Ed, this is some work that Jane has been leading on. Jane Coates has been leading on in her capacity as chair of the implementation group. So we are exploring it at the moment. What we want to make sure is if the HESA, the way that those roles are coded is limited in relation to what has been expressed in that question, that we capture in a different way, probably in a narrative type way, in the spree space. So it's very much a work in progress, but we're very cognizant of this challenge, and to work through some of the issues with the challenge to come up with something that is reasonable for our disciplines.
Great. Thanks, Jo. That's really helpful, and thanks, Jackie, for the question. And just in terms of that work that Jane Code, who chairs the implementation group that we have at the council, looking across clinical academics in nursing, midwifery and allied health, the work we are talking with HESA about it involves potentially longer term changing the data collection process for HESA to encompass a broader range of contract types and different contractual arrangements that would address the point raised here. I don't know whether that will all have worked through by the time we get to the end of this ref cycle. So yeah, it'll be one that will have to be thought about through as we go through the exercise. Great, thank you very much for that. So colleagues, are there any other questions at the moment for Kim or Jo? I think they feel like they're getting off lightly here. But if everybody has been able to have their questions answered and the session was a very clear setting out of where we are at the moment, then I'll take this opportunity to thank Kim and Jo for their time this afternoon and for all of their hard work on behalf of the sector to take forward the exercise. It's a massive undertaking, as we all know, both for the universities making submissions and for those involved in panels and the central team. But yeah, we're moving forward at pace now. So thanks again for all of your involvement in this, and thanks for sparing the time to be so helpful to our group here today. So a feedback poll will have popped up for people who've joined the webinar today. Thank you very much for completing that. It's really helpful for us to get feedback on how useful our webinar program is to our members and to other participants. The recording from today's session will be circulated, so you can see this again if you want to watch it back. And we will obviously be keeping you up to date on the developments of the exercise as we go through the next couple of years towards the submission deadline and then the publication of the results towards the end of 2029. This was part of the research month for the Council of Deans of Health. We're in the middle of that month of focus on research, knowledge exchange and innovation here at the Council. So do keep an eye out on our website for other events, podcasts, blogs related to the broad theme of research across nursing, midwifery and allied health. And if there's something that you want to contribute towards in terms of research month, either this year or maybe a year in the future, then please do get in touch with the team and we'd be delighted to see how we can accommodate you in a future research month. And so I think at this point I'll bring the session to a close and let everybody go and have some lunch if you haven't already. So thanks again, Kim. Thanks, Jo. And look forward to seeing you all very soon. Thank you.